Okay, hello everyone. What I would like to do is take you through Chapter 9. That's the chapter on lifespan development. So, lifespan development here is development across the lifespan. So, this would be from the moment of conception to old age and eventually death. So, this is a focus of developmental psychology. I would say it is one focus. It is certainly an appropriate focus for an introductory textbook, but developmental psychologists will often specialize in a particular stage of life. Some are infant and childhood specialists, others are adolescent specialists, others are old age specialists or gerontologists. So we've begun our discussion of lifespan development. We'll talk about some theories, lifespan theories, stages of development. There are a number of stage theories in developmental psychology, and then we'll end it with some discussion of death and dying. So you can see three domains here: physical, cognitive, and psychosocial development. And so physical development is really the growth and changes in the body, the senses, and the brain, and so forth. Cognitive development has to do with how reasoning, thinking, problem-solving ability changes. And psychosocial development involves essentially personality and social relationships with a strong focus on social relationships. Research methods, you can see naturalistic observation is a method. In developmental psychology, what we sometimes do is have a playroom set up. So the playroom would be a room where kids can go in there with their parent or caregiver, and the room would be set up with toys and so forth, and then there would be a two-way mirror through which observation can take place without the observer being observed. This is kind of a common setup in developmental psychology labs. There usually is a playroom where naturalistic observation will occur. And of course, video equipment is used a good bit. So you can have a small, unobtrusive camera in a room and accomplish the same purpose. Also record the behavior of children. So you can do naturalistic observation in a number of settings. The playroom in a developmental psychology laboratory would be, that would be more controlled and suitable for laboratory experiments. But also you can observe wherever the kids are. So playgrounds, daycare centers, even in the child's own home. Case studies. Again, a case study is just collecting a great deal of information in a systematic way on one individual. Usually this would be an exceptional or unusual individual, but not necessarily. I mean, you could certainly do a case study. So this is, again, clinical work, certainly children with psychiatric or psychological problems that are unusual would be subject to case study. Now, there are other approaches. Again, case studies. You could talk about Freud's analysis of little Hans, or or the case of Jeannie. There are a number of cases. Jeannie is an interesting case because she was kept in extreme isolation up until about age 13, and then was rescued from that horribly abusive situation, and ultimately never developed language skills. She could communicate, but not with language. So she had fairly well developed body language. She could often get across what she wanted to other people, but she couldn't do it with words. So that kind of severe isolation can lead to very severe deficits. You can see that all the methods we talked about, surveys or self-report surveys, again, this works, but often survey research with kids would be surveys filled out by their parents. So this is, this approach is used a fair amount. And then again, experimental settings like a playroom in a developmental psychology lab would be where you do controlled experimentation with kids. Now, the normative approach to development is just essentially looking at developmental norms. What is normal for a particular age? And so this has been worked out in some detail, and so you can determine what the milestones are. For crawling, for instance, at what age do kids begin crawling on average, walking, riding, etc. So that's what we mean by the normative approach to development. Issues in developmental psychology, the idea is development continuous or discontinuous? I think a lot of people would say it's continuous, but nonetheless, many of the developmental theories, certainly the most influential, like Piaget's theory, are a set of discrete stages. But the transition from one stage to the next is not, it's not really clear or stepwise. It is more like this. It's more like a gradual change between what a child is able to do at one stage versus another. But the stage idea has still been very influential, and it still helps to kind of characterize our thinking about development, or classify how we can refer to a kid in a particular stage of development, or children and adults for that matter. Every human is at some developmental stage in the lifespan approach. Everybody is at a particular stage. Now this bit here, nature and nurture. Nature is sometimes called the nativistic approach. This is the set of abilities that one is born with that would be due to biology and genetics. The nurture approach is sometimes referred to as empiricism. In essence, the interaction with the world, the interaction with objects and people in the world influences behavior. And so we could think of some forms of behavior being primarily nature. For instance, there is a measure that's frequently used called a heritability measure. And a heritability measure is a measure of the proportion of some behavior or some ability that is accounted for by genetics. So it's a proportion of some behavior or ability accounted for by genetics. And usually it's measured between 0 and 1. Usually carried out to 2 decimal places anywhere between 0 and 1. So you can get a heritability calculation. Heritability calculations are done, I guess the gold standard would be looking at concordance rates between identical twins. So a monozygotic or identical twin is someone or two people who are genetically identical. So if you see some trait or ability or behavior manifest in one of a pair of twins, then the proportion you see it in the other twin would be a way we calculate heritability. So heritability is the most commonly used measure of nature. And then nurture is just the influence of the environment, influence of factors in the environment, people, places, things, animals. It's the influence of the environment in which one lives on behavior, ability, and so forth. There's been a good deal of attention paid to the effect of socioeconomic status, and that's, of course, very environmental. The socioeconomic status is generally calculated in terms of education and income and your zip code, where it is you live. And so if you look at a combination of these things, education, income, and where you live, you can get an estimate of SES, or socioeconomic status. And generally speaking, the higher one's socioeconomic status, the higher standardized test scores are, for instance, the higher high school graduation rates are, and so forth. So people who have a higher socioeconomic status tend to have advantages and do better in a number of domains than people who are of lower socioeconomic status. And one thing that Hart and Risley here has pointed out with their research is children born into a higher socioeconomic status have more interaction with their parents, their caregivers in a verbal fashion. So they interact verbally, they are read to more. So it is important to have books read to you as a kid. This is part of how children learn words and learn the rules of grammar and learn language. And as you learn a little later on in the chapter, there are sensitive periods. There are points in development where you're more sensitive to particular kinds of stimulation. And language stimulation, it just happens to be the case that you're more sensitive to language stimulation when you're a young child. And so the ability to hear language spoken and also to see words written on a page is something that it's like a window that's open, a window of opportunity to take in that information. Neural connections are made, and if there isn't proper stimulation, neural connections may not be made. And so when I spoke about Jeannie earlier, being in this very extremely impoverished environment, completely devoid of stimulation, she never learned language. She never learned to speak normally, never learned to communicate normally, and that's because that sensitive period was essentially there was no incoming information, and so those neural connections never developed. And so this is really important idea here. It's just a way to demonstrate through careful research that hearing language when you are a young child is so very important. So this can't be emphasized enough. And states that have language programs where children get exposed to reading and have books read to them, if not by their parents, then by someone, or better yet, programs to educate the parents enough to read the books to their kids. It can be a real life changer and often help to break a cycle of poverty and help those kids as they get older to not be low socioeconomic status, to level up, to be more successful in life and be able to enjoy more opportunities. So programs like this are very, very important. So we're going to get into a few lifespan theories here. We're going to talk about Freud, Erikson, who was essentially a student, if you will, of the Freud family. He was Erik Erikson was good friends with Freud's daughter Anna, and was he's someone who took Freud's ideas and developed them in a different direction. And then Piaget, and finally Kohlberg. But all these theories here have one thing in common, and this is the idea of development progressing in stages. So keep that idea in mind as you go through the rest of this. Development progresses in stages. And really the first theory that we have is Sigmund Freud's theory of psychosexual development. So how to discuss this? In chapter 2, we mentioned briefly that Freud had a theory of the mind, or the psyche, and the mind is divided into 3 parts. So there's the id, and this part of the psyche called the id is the source of our primal urges, the urge to eat, the urge to be aggressive, the urge for sexual intimacy. All of these things are urges that arise from the id, and he divided these urges into 2 broad categories: life urges, or eros, and death urges, or thanatos. And so thanatos would be manifest by people behaving aggressively and destructively. Life urges, ultimately for Freud, were sexual. And so this manifestation of life energy for Freud is something he called libido. And any focusing of libido on a part of the body would be, or essentially the part of the body where the libido is focused is an erogenous zone. And there are 5 stages to this particular theory. There's the oral stage. So here the libido is focused on the mouth. The anal stage, so the libido changes its focus, focuses on the anus. The phallic stage is where the libido is focused on the genitalia. Then the latency stage, the libido is focused, well, essentially not focused. There is a particular conflict that occurs during the phallic stage of development. Part of the resolution of this is for a time, children become, we might say, asexual. And then with the onset of puberty, he says, there is a genital stage of development. So this idea, and we'll have much more to say about Freud later on, but this idea of stages of development, in this case they're called stages of psychosexual development, this was very influential on people who came along later. Now, another term here that you'll see that we'll talk about a little more later as well is the idea of fixation. If you are fixated at the oral stage, then you are focused on stimulation of the mouth, and this could be in a number of ways. It might be through food, either eating too much or not enough. It could be through smoking. Freud himself had an oral fixation. He smoked at one point about 20 cigars a day. It was so bad, his addiction was so bad that he developed cancer of the mouth and jaw, and eventually he had to have something like 30 different surgeries to remove cancer in his mouth and jaw. Ultimately, his jaw was removed, and he had this kind of plastic prosthesis. He called it the monster, and his daughter was his main caretaker. Hannah was his main caretaker, and he would have this monster inserted, and he would kind of get ready for his day. But it was a painful procedure. But even then, even after all that, he would still get a cigar and light up. So an extreme oral fixation, we could say. So that's just a little bit on Freud. But the main thing, the main takeaway right now is the idea that Freud's approach sets the stage for developmental theories that focus on development occurring in stages. Now, Erik Erikson, here he is, Erik Homburger Erikson. Actually, he defined himself, he named himself. He was the son of a single mother, and his mother really was never forthcoming with the identity of his father. And so he became somewhat obsessive on issues of identity in his theoretical work. So again, Erik Erikson, as a young man, was trained by Freud's daughter, Anna Freud, in the psychoanalytic approach. He was psychoanalyzed. His primary academic credential was that he was psychoanalyzed by a member of the Freud family. And back in the day, back in the 1930s, that was good enough. You know, you could go and use that as a credential to practice after a time, after you're certified and blessed by the Freud organization. You could go and practice as a psychoanalyst, which he did for a time. Erikson was very interested in human development, and one of the main things that he focuses on, I'm going to show you the summary table here. So this is Erik Erikson's stages of psychosocial development. So now remember, Freud's stages were called stages of psychosexual development. Erikson's stages are called stages of psychosocial development. And there are 8 of them, and so there are ages associated with these stages of development. And there is a developmental task. He sometimes referred to these as crises, a developmental crisis, or a choice point, you might say. There's a choice that's made, there's a resolution to the developmental task, and there's an outcome. And for each of these developmental tasks, there is the positive outcome and the negative outcome. And if you resolve the task positively, then you proceed to the next stage and so forth, and you do just fine. But you can get messed up at any one of these stages of development. So for example, in stage 1, trust versus mistrust, you can think of children, infants. So it's age 0 to 1. Infants who have their needs met consistently and in a caring way develop trust. And infants who don't have their needs met consistently in a caring way become mistrustful. And this is a pattern, according to Erickson, that can persist for the rest of a person's life. Just basic trust versus mistrust. Autonomy versus shame and doubt, ages 1 to 3. Being autonomous is just being independent, being able to do things for oneself. And the downside of it is sometimes kids stop trying to do things for themselves, perhaps because they've been punished. But for whatever reason, if you come down on the shame and doubt end of things, that again could set a pattern for the rest of your life. So you get the idea. These stages can set a pattern, and in psychotherapy, that would have to be re-examined and hopefully corrected. And again, Erickson was a psychoanalyst as well as a developmental theoretician. So you can just track through these: initiative versus guilt, industry versus inferiority, that essentially ages 7 to 11. That corresponds, by the way, somewhat closely with Freud's latency stage of psychosexual development. But this is essentially what we might call the school years. When kids are in elementary school and they start engaging in social comparison with other kids, so get the psychosocial development. There's a lot of social comparison that occurs in school settings. The kids who are good at sports versus the kid who's always the last one picked for the kickball team, something like that. So kids learn that hey, they can do some things well. They learn that they don't do other things well, and that's part of it. But if overall one develops a sense of inferiority, then of course that can have negative consequences for the rest of a person's life. Now stage 5 here, intimacy or identity versus confusion or role confusion. This was the most important stage according to Erickson. So I mentioned a little bit about Erickson and his his personal sense of identity, and he named himself Erickson. So essentially he just created an identity for himself and lived it. But identity for Erickson, in terms of his theoretical work, this is the area that is most supported with research. There are, for instance, James Marcia's identity statuses. These are very well supported with research. Let's see. Moving on, intimacy versus isolation. So is this idea of emerging adulthood that you're starting now to see in textbooks. Being a young adult, you're starting to want to find a person or persons with whom to share your life experience with. Generativity, you can see essentially the biggest chunk of adulthood. Generativity is very tied up in career choices, career success. And if you feel successful, you feel like you're making a contribution to society, if you feel like you're a part of something bigger than yourself, then you have a sense of generativity. And just think of people who've been in long-standing careers who lose that career, or get laid off from their jobs. Often they stagnate. They that can send someone, an adult human, into quite a tailspin. Now, getting to the last stage, integrity versus despair. Essentially, when you get to be old, you've got more of your life behind you than in front of you, so the natural inclination is to reflect on the life you've lived. And if you feel upon reflection on your life that you have a life well lived, then you have what Erickson calls integrity or ego integrity. So that gives you an idea. This also is one of the first lifespan developmental theories, because this really looks through or takes us through all ages of human life. And that's one of the things that we have to thank Erickson for in terms of the lifespan development approach. Now, Jean Piaget is known for a stage theory of cognitive development. So cognitive development is the development of thinking and problem-solving ability, and so forth, reasoning ability, and so his approach, and there he is. There's Jean Piaget in his later years. His approach is that we have schemata or concepts or mental models that allow us to interact with the world. And our schemata can be changed. So if you can think of, let's say, a young child who maybe has a cat in the home, and so then refers to any four-legged animal as kitty. And then when the child encounters a dog, if a dog is not in the home, all the child is used to is cats, then the child will refer to the dog as kitty. Oh, that's assimilation. All right. So the child has a schema, that's singular, and that is applied to any furry animal with four legs. But over time, the child learns to modify that schema. So if you're just applying what you already have, the schema or the schemata that you already have to any situation, you're assimilating. If you are able to modify your schemata on the basis of new information and change your schemata, broaden your perspective, so to speak, then you are accommodating. So that's the difference between assimilation and accommodation. Learning that there are different four-legged animals and they're called different things is something that children have to learn, and according to Piaget, their schemata change as a result of accommodation. Now, this is table 9.2 here is Piaget's stages. This characterizes his stages of cognitive development. And you can see it's essentially birth to about 2 years. The first stage is called the sensory motor stage. And so this is just experiencing the world through the senses and one's own actions. And so there are a couple of developmental issues in the sensory motor stage. Object permanence. Object permanence is the idea that an object continues to exist even though it's no longer in front of you. If you do not have this major concept of object permanence, then a thing like a toy in front of you would just be treated as if it is not there if it's covered up, for instance. And so that's your basic test of object permanence. Stranger anxiety, that is something that a lot of children experience, and that is often at the forefront in the sensory motor stage. Let's move on. The pre-operational stage. So one thing you have to know about Piaget is this idea or this concept of an operation. And an operation is just a concept that can be reversed, like 2 plus 1 equals 3, all right? 3 minus 1 equals 2. If you're able to reverse it, if you're able to reverse a concept or an operation, then you are at Piaget's concrete operational stage. So being able to reverse an operation. But if you are not able to reverse an operation, or you don't really have operations actively, or you're not actively engaging with mental operations, then you're what he referred to as pre-operational. But you can see what happens during the pre-operational stage is children learn to use words and images to represent things, but they're not reasoning logically. In other words, they're not able to reverse operations. So you see things developing, pretend play. All right, so think about it. That's essentially representational thinking. It characterizes representational thinking. Egocentrism is the idea of a point of view or a perspective. Generally speaking, kids who are in the pre-operational stage don't really have any sense of perspective other than their own, or a sense of point of view other than their own. They don't fully appreciate that other people have a point of view. Now, toward the end of the stage, they start coming out of that, but that's something that is a rather gradual process, being able to engage in some amount of perspective taking, trying to see things from the point of view from another is something that gradually improves even through the teenage years. And then language development. Language development, there is just a huge explosion of, we could say, neural connections for language, a vocabulary explosion that occurs during this stage. So you might go from, say, 300 or 400 words to, maybe 15 to 20,000 words. Almost the full lexicon of an adult by about age 6, which is huge if you think about it. So just a huge expansion of language development occurs during the pre-operational stage, and of course that continues. But the biggest, most noticeable growth in language development occurs during the pre-operational stage. Concrete operations would be how I described operations and being able to reverse them, like 3 minus 1 equals 2, 2 plus 1 equals 3. So mathematical transformations start making a whole lot more sense to kids. And also this idea of conservation, the idea that objects, things in the world might, they don't change into something different from what they are. They may take different forms, and we'll try to go through some of Piaget's conservation tasks, but probably the most famous one is the conservation of volume task. And so you start out and you have, let's just say, 2 normal-sized glasses of Kool-Aid, and they're equal sized, and so you put those in front of a child and say, are those the same? The child will say yes. And then you take one and you pour the liquid into a taller, thinner container, and you ask the child, are those the same? Well, if the child is still pre-operational, they'll say, no, it looks like the taller, thinner container now has more. But if a child has achieved conservation of volume, then the child is mentally able to reverse the operation. The child will say, no, that doesn't have more. It's still the same amount, because all you need to do is take that liquid and pour it back into the original container. So the idea of being able to reverse the operation, again, very important. And then formal operational thinking has to do with thinking and problem solving in a systematic way. What happens usually during concrete operations when children are given complex problems to solve is they approach the problem, they set up the problem in a kind of simplistic trial and error fashion. And as children progress and enter into the formal operational stage, they begin using algorithms to solve problems. They begin using mathematical procedures to solve problems, and they don't rely on chance or guessing or trial and error. So they become more systematic in their approach to solving problems. And then thinking abstractly, thinking, playing the so-called what-if game. What if? And then you can just say, what if one thing that I heard on the radio as a kid, what if we drained Lake Michigan and filled it up with hot chocolate, and then we put whipped cream on top of it? All right, that's a what if game. All right, now you can't really do that, but what if you did? You get the idea. So again, that's an abstraction. And then there are abstract concepts that become more important as one gets into formal operational thinking. So think about something like justice. So you can think about all the scales of justice or something like that. That's abstract thinking. And so thinking about things like that really, you don't see justice physically. You don't really observe it. It's more of a concept that you might see in action, but not necessarily that you can concretely observe it. So abstract thinking, moral reasoning becomes more developed. I mentioned earlier perspective taking, being able to take the perspective of another person, developing a sense of empathy. Becomes more developed as a child progresses into and then through the formal operational stage. Now, I would have to say that more recently, and you can see the dates on these studies here, in more recent years in developmental psychology, there have been a number of tests of Piaget's stage theory. So one approach might be that we look to see whether Piaget was correct. So for instance, does object permanence occur at 9 months, or might it occur earlier? And that's what Renée Baillargeon has done with some of her studies. She's been able to demonstrate that it certainly looks like infants as young as 6 months old, and maybe even a little younger than that, have some sense of object permanence. But she had let's just say a better developed experimental methodology than Piaget had. So Piaget's idea was a starting point. His theory was a starting point, and so now we have people going and collecting more information in with greater sophistication in terms of methodology, and learning that, well, it looks like object permanence actually occurs earlier than what Piaget said. But again, you know, that theory was a great starting point and initiated a lot of this research. Another thing would be that as people progress into the formal operational stage for Piaget, that was you know, that was it. Your cognitive development was completed by around age 12, and that's something that other researchers, you know, that's something that was tested. It was put to the test, and so now we have a number of demonstrations that you know, there are aspects of problem solving and so forth that really do continue to develop well past age 12 into adulthood or emerging adulthood would be young adulthood, and then even older adults. The cognitive changes of older adults are now beginning to be recognized and appreciated. So it is possible. It's not like it's all over, it's all set once you hit formal operations, but rather there are forms of development that are relatively continuous, even into middle adulthood and beyond. Now, moral development, and the guy here is Lawrence Kohlberg, had one of the theories that was pretty widely cited in introductory textbooks. For instance, I have not seen an introductory textbook that doesn't talk about Kohlberg's theory of moral development. Kohlberg based his ideas regarding moral development on Piaget. All right, so Piaget had a theory of moral development, and Kohlberg expanded on that, and so he used this kind of a story method, a story where there is a moral dilemma. All right, so a moral dilemma would be a moral decision has to be made, and it's a difficult decision, and pretty much at the end of the story here, and you know, should the person have done this thing? So you set the stage for the story, you tell the story, and then should the person have done this thing? Was that the right thing to do? And it's not so much whether a person thinks it's right or wrong, but how the person explains why it's right or wrong, or whether the person should have done it. And based on a person's responses, again, the responses are responses in an interview. All right, so the story is explained to a person, and then the questions follow, and then how the person explains his or her responses is what places that individual in one of these stages of moral development. So you can see level 1 is pre-conventional. You know, he shouldn't have taken the drug to save his wife because he's going to get punished. So you don't do it because you'll get punished. Or perhaps, you know, it's all right to, you know, to steal the drug to save his wife's life, because, you know, he gets to keep her as his companion, and that would be a good thing. Yeah, something like that. Or she will love him if he does. You know? So, you know, it just depends on the complexity of a person's reasoning behind why they say whether it was the right thing to do or not, or should he have done it or not. And then the conventional stage, which is where most people are. You know, it's driven by social approval, or it's driven by authority. It's against the law, therefore you don't do it. You don't break the law. That would be conventional morality. And then we get into post-conventional morality, and I'll just move up to stage 6 here. The idea that there are universal ethical principles that essentially overarch any kind of decision. So you could say, you know, life is sacred, and it's the right thing to do to save life. And so if your response is something like that, then you're making a case that your reasoning is based on some kind of universal ethical principle. Now, Kohlberg's approach is not without its critics. One critic, a major critic of Kohlberg, was actually his student. Her name was Carol Gilligan, and she said, well, this whole approach that Kohlberg used was based on what she called a justice orientation. And when she saw a gender difference as well. So men, and this is late 60s when this research was done, men tend to come down on a justice orientation, where women tend to have more of a caring orientation in their moral reasoning. So there are orientations to moral reasoning like justice or caring, and that idea, which is not mentioned in your book, has been expanded even farther. And one of my favorite theories in psychology right now, a fairly new theory, it's called moral foundations theory. And moral foundations theory was proposed by Jonathan Haidt. I'll spell that for you in case you want to look it up. H-A-I-D-T. You can find this theory at moralfoundations.org or yourmorals.org. I think he has both, but you can Google moral foundations and find it. But this approach is something now that really encompasses Kohlberg's idea of justice, Gilligan's idea of caring, and other moral foundations, other foundations for moral thinking, in a very well-constructed psychometric instrument. So instead of interview methods, storytelling, and so forth, now we have a really nice survey instrument that we can use to evaluate moral reasoning. And this instrument is called the MFQ30. It's just Moral Foundations Questionnaire 30 for 30 items. And there are 5 moral foundations, and there are 6 items per foundation in the instrument. So this is something that really, I think, is at the leading edge of any discussion of moral reasoning. You have to look at moral foundations as well. And I'll try to direct you to the website with a link. Okay, so now we're into stages of development. And here we're going to talk about just the stages of prenatal development, and we'll get into physical and cognitive development and emotional development. All right, so we have the germinal phase, the germinal stage, weeks 1 and 2. So this is, you know, essentially going from the moment of conception on to formation of a zygote, and then we get the process of cell division beginning to occur. So when you get into weeks 3 to 8, the zygote divides, and then we get, once there is implantation in the lining of the uterus, we get the formation of an embryo, a blood supply to the developing embryo, and the connecting structure that provides oxygen and waste removal, nutrition to the developing embryo, called the placenta. The fetal stage is weeks 9 to 40, and so you can see this. There's just a huge amount of physical development that begins at week 9, and then you can see here just kind of the prenatal milestones, if you will. at 12 weeks, the sex organs differentiate. Now, what is interesting about that is in the male baby, when the testes differentiate, they start cranking out testosterone, and that has the effect of driving the development of the nervous system in a characteristically male direction. So there are areas in the brain, as the brain develops, that are influenced by the presence of that sex hormone. And so, if all proceeds well, you get both a physically differentiated male as well as a male brain. Now, the reason I bring this up is that is kind of the big bit of differentiation that occurs. Obviously, the differentiation of the sex organs, but also the differentiation of the nervous system. And there are a number of what we call sexually dimorphic areas in the brain. And that just means that there's a different form that you see in males and females. And a lot of that development occurs prenatally. A lot of these this differentiation. So not only is it what you can see physically on the outside, but also on the inside in terms of the development of the brain. Of course, it's always good to get good prenatal care, avoid alcohol, avoid drugs, eat well, and if prenatal care is good, then that helps to minimize the possibility of birth defects. One is folate or folic acid. Folic acid is present in a good diet, but if it is insufficient in quantity in the diet, there can be defects in the formation of the spine around the spinal cord. And it's one of the leading causes of a disorder known as spinal bifida. And essentially that just means the spine doesn't fully enclose the spinal cord. And so spina bifida is treatable. Actually, you can look it up. You can look at fetal surgery for spina bifida, and you can see that sometimes that repair can take place. So what happens actually is the amniotic fluid is drawn out, the fetus is removed, there's a surgical repair performed, the fetus is then put back into the uterus, and the amniotic fluid is replaced, and if all goes well, there's no leakage, and the baby will be born full term, hopefully with no spinal defect. Now, this idea of teratogen. Teratogen is really any environmental agent. So you can see it can be biological. So teratogens can be a disease agent, a virus, for instance, German measles, rubella, can cause a number of physical defects. If a woman is pregnant and she catches this relatively mild disease otherwise, but if she's pregnant, it can cause a number of problems like congenital cataracts, mental retardation. It really does a number on the developing fetus. In the news right now, you've probably heard of Zika virus. Zika virus is a mosquito-borne illness that is apparently causing a number of problems, one of which is microcephaly. The bones of the skull are not developing properly and growing properly. Essentially, excuse me, I have to stop. Okay, now I can start again. Zika virus, biological agent, can cause birth defects. Chemicals, environmental chemicals are associated with birth defects. Back in the late 50s and early 60s, there was a drug, a sedative that was given to women who were pregnant that was not a good idea. That drug was called thalidomide. And thalidomide is a fairly mild sedative, didn't really cause any problems with anyone other than pregnant women, but it caused a number of physical deformities in infants. So check it out, thalidomide. You can look through Google Images if you like to see the effects of this. It's devastating what that drug did. Now most of these individuals survived, but they survived with very abnormal growth of their arms and legs. So most individuals did not develop arms or legs, or at least normal functioning arms and legs. So that's what that drug did. And then there could be a physical teratogen. So, physically something someone does, perhaps exercising too much or not eating enough and so forth. All of that can cause problems with fetal development. Now, probably the most awful pervasive teratogen, the one that's been very well studied, is alcohol. And alcohol causes a number of birth defects. And the constellation of symptoms surrounding the effects of alcohol during pregnancy and the defects that then manifest is known as fetal alcohol syndrome, FAS, fetal alcohol syndrome. And so you can see a number of very really just devastating defects. Below average head circumference, along with mental retardation. Also, even when small amounts of alcohol are consumed, there's a greater risk of development of attention deficit hyperactivity disorders. So, so sometimes you don't even notice it, but behaviorally it can have an effect. Fetal alcohol syndrome is just horrible, and this affects a person for life. So if you're pregnant or think you might be pregnant, don't drink. There is no safe level of alcohol to partake of when one is pregnant. Just don't drink. Smoking is a teratogen, reduces oxygen levels. Kids of mothers who smoke have frequently low birth weight. So low birth weight is one of the main symptoms here of smoking during pregnancy, but greater risk of sudden infant death syndrome, or SIDS. And then a number of other drugs. Drugs that people sometimes take recreationally: heroin, cocaine, methamphetamine. All of these, a whole wide variety of prescription medications for a variety of ailments can have teratogenic effects. And so, ideally, if you can get through a pregnancy without drinking, doing drugs, and but also eating a good, proper diet, then your baby will certainly be better for it, better off for it. Now, another thing is, when any there are times during pregnancy, but also during the young life of an organism where exposure to teratogen might be particularly harmful. And so that would be a sensitive period. So there are sensitive periods of prenatal development where exposure during that period is worse than exposure at another period, for instance. So that's why this idea of sensitive period is mentioned here. And of course, public policy. Should women who are drinking or doing drugs so while they're pregnant be incarcerated or confined just so they don't do those things, so that their babies will be born healthy? That's I'm not going to get into public policy, but it's certainly a consideration. Should it be the law? Now we get into newborn reflexes. So once a baby is born, a reflex would be a behavior that is engaged in when appropriate stimulation is applied. The behavior occurs. The behavior occurs automatically. So these are inborn automatic responses to particular forms of stimulation. And what I'll try to do, instead of just explain all of them here, is put some links up so that you can see some of the infant reflexes. But the grasping reflex is one we all know. There's a sucking reflex, a rooting reflex. There's something called the Moro reflex. All of these reflexes are, and the stepping reflex, essentially the motor pattern for walking is there. And also we see during early infancy mirror behaviors, mirroring of facial expressions tends to occur a little more. So physical development, I'm not going to put a whole lot of time into this, just to say that there's a lot of physical development that occurs during childhood. I mean, that's what's one of the main things that characterizes childhood. But you also got to think of the development of the nervous system. The nervous system is becoming increasingly specialized and complex. When we talk about the development of the nervous system, there are areas of the brain that are expecting stimulation. For parts of the brain to develop normally, they have to get they have to receive input from the environment through the sense organs. And if that input is not received, then those areas of the brain do not develop normally. So I mentioned the story of Jeannie and her lack of developing language. Well, again, through the ears and eyes, seeing people speak, hearing people speak, really facilitates the development of normal speech and vision, and the association of the two. This is, these areas of the brain are what we might call experience expectant. You just got to have the normal daily stimulation. Now, you don't necessarily have to go overboard with it and overstimulate, because it is possible to overstimulate an infant. But just to have a normally stimulating environment is important. Motor skills, the development of motor skills, is something that becomes increasingly complex. So, we have gross motor skills. Think of walking and toddling. Toddling is actually, it refers to a mode of locomotion that is rather clumsy. And so we would call that walking, but it's a gross motor skill versus fine motor skills would be like using the fingers, or like holding a crayon and making a drawing. It's really moving toward fine motor skills. learning to write, for instance, would be development of a fine motor skill. I've just got to put in a plug for musical training. Musical training helps develop fine motor skills, and it's it creates environmental stimulation at the same time, using one's hands to play an instrument that makes sounds that stimulate the ears, and it facilitates development in a number of ways. So musical training, especially if it begins early, can result in development of perfect pitch, knowing how to discriminate pitch and know exactly what note is being sung or played. For instance, people who develop perfect pitch often are people who were given musical training at a young age. So here are some developmental milestones. You can just say ages 2 to 5. So we have categories of these milestones: physical milestones, personal or social milestones, language milestones, and cognitive milestones. So I would say give that some study. Certainly, I'm not going to just go through every single one of these, but study them. I think this particular summary table is a very good one. Give that some attention. I'll probably ask some questions on your next exam, the upcoming exam, about some of these developmental milestones. So remember that they are in different categories and they occur. So they, you need to know what age they occur as well. So I'll probably ask 2 or 3 like that. Now, this is an example. I mentioned Renee Bayerjean and her study of object permanence, and the idea that object permanence is that an object continues to exist even though you don't see it anymore. If you know that an object continues to exist even though you don't see it, even though it's not right in front of you, then you have acquired the concept of object permanence. And this is a clever study that she did with infants younger than 9 months. And it's essentially, she called it the impossible situation, like a toy car or a toy truck going through an apparently solid object from the child's perspective. And so she would have this little stage in front of an infant. Usually the infant would be placed in a high chair, and she would do this little demonstration of the impossible situation, like a car going through a solid object. And when children see these impossible situations, they look at that situation longer. So she had fancy video equipment, and she was recording children, infants, as they experienced this situation that she contrived in the laboratory. And so she was able to surmise from this that children much younger than 9 months old have a concept of object permanence. Okay, here we go. So this is psychosocial development in terms of attachment. And attachment theory goes back probably 60, 70 years. One of the major early figures is a fellow named Harry Harlow. And Harry Harlow did a series of studies. This was at the University of Wisconsin. He did a series of studies of infant monkeys that were separated from their mothers. And what he did is something pretty interesting. He would take an infant monkey that had been separated from its mother, and he gave it 2 surrogate mothers made of chicken wire. And so one chicken wire mother had a nipple on it with a baby bottle, so the monkey could go to that and get nutrition. And The other wire mother was covered with terry cloth, soft towel. And essentially the baby monkey clung to the cloth mother and only went over to the wire mother to get nutrition. And that's the only time. So it would then go back to the cloth mother. Now these baby monkeys also experienced a number of developmental deficits in terms of being able to socially interact with other monkeys. But one thing that came out of Harlow's early research was that contact comfort is important, that touch is important. And it helped to break down some of the prevailing views of child rearing at the time, and kind of started to make it okay to hold your baby. So nowadays we don't really think much of that, but there was a time when parents were recommended, okay, just put the baby down in a crib and let him or her cry himself or herself to sleep. And so that series of experiments that Harlow did with monkeys kind of helped break that idea down a little bit, and the idea of touch and contact comfort was something that became more important in child rearing. And then a little later on, John Bowlby really developed modern day attachment theory more, and his famous student Mary Ainsworth. So John Bowlby was really the theoretician for attachment theory, and Ainsworth developed an experimental method that helped to measure attachment. And so what she did is she developed an experiment or an experimental situation called the strange situation. So again, one of these laboratory playrooms was used with a two-way mirror, and she would have you can say mom or primary caregiver and infant come into a room together. There are toys in the room. And this occurs at I think it's 3-minute intervals. So mom and infant come in, they spend 3 minutes together. Mom leaves the room, and then later a stranger comes in, stays with the infant for 3 minutes. The stranger then leaves. Then mom comes back, and what you're wanting to see is how the infant acts when mom leaves, whether the infant interacts with the stranger, and then whether the infant is glad to see mom when she comes back. And if, for instance, when mom leaves, is the infant looking at mom as the secure base of attachment. So securely attached infants look at their caregivers as kind of a base. They kind of maintain eye contact. They check back every so often to make sure that that person's still there, but then they'll go out and they'll explore and play and interact maybe with other people or animals or toys and or other kids. And so that kind of attachment, based on the outcome of these strange situation experiments, is what Mary Ainsworth called secure attachment. That's essentially the best situation. That's the best situation we can hope for, is that a baby is securely attached to its mother. But there are other styles of interaction that occur in the strange situation. So with avoidant attachment, the child's unresponsive to the parent. The parent is not seen as a secure base. And if the parent leaves, the child doesn't get upset. And when the parent returns, the child may not make a big deal about it. All right, so it's just kind of avoidant. And so the inference then is, the caregiver, parent, is probably inattentive and insensitive to the child's needs. And so, being a parent means being attentive and sensitive. And if you're not, it can have an effect on your baby. So you gotta do that. I mean, you gotta have that degree of sensitivity. Resistant attachment. Children tend to be clingy, and then if mom leaves, there's often a good bit of separation anxiety, and often when mom or caregiver comes back, the child may be inconsolable for a while. So sometimes that's called resistant attachment. And again, it's probably due to just inconsistency in attachment to begin with. And then finally, we have disorganized attachment, and that's pretty much just like it sounds. It's like this would be a situation where a parent or caregiver just doesn't interact much with the kid at all. It just kind of leaves the kid on his or her own, and or is abusive toward the kid. And that is, of course, the worst of all of these situations. So this has been well supported by a variety of studies using that strange situation scenario. Let's see, self-concept again begins around, let's say, 18 months. There's a classic test. It's called the rouge test, and you just take some rouge or some lipstick and you put it on baby's nose and put the baby in front of a mirror. And the idea is if there is self-awareness or self-concept formed, then the baby will try to remove the lipstick or the rouge by looking in the mirror. And so then we say self-concept is formed. And then we can also look at how social behavior matures during childhood. And again, I would go back to the summary table and look at the social behavior column. Let's see here. Yes. Diana Baumrein's research on parenting styles. So parenting styles are really, there are two factors to keep in mind. There would be love and affection. All right, that's one factor, is love and affection. And the other factor is limits or rules, having rules and limits. All right, so if your parenting combines love and affection as well as rules or limits, then you're referred to as authoritative, and that's the best of all parenting styles, certainly associated with the best outcomes in the children. Now, another style is the authoritarian style. Not much love and affection, but definite, strict rules and limits. We could look at permissive, lots of love and affection, not so much on the rules and limits. Not many rules, not many limits. So you may have, so you can think of examples of each of these. And then I guess the last style would be just an uninvolved style, where not much love and affection, not any rules or limits either. The parents are just not really paying attention to the kids at all. Sometimes it's called the indifferent and uninvolved style. Again, the best outcomes are associated with the authoritative style. In certain cases, authoritarian parenting may be, useful if, for instance, a child is living in a dangerous area, dangerous neighborhood where they need kind of the parent needs to be constantly vigilant and protective and controlling of the child's behavior to keep the child out of trouble, that kind of thing. So in some cases, authoritarian parenting may be useful, but almost always the authoritative style is the best. Permissive parenting, the kids may be happy, but they're not well adjusted in the sense of they have no sense of boundaries. So they may, they're probably the kids who are just wandering all over the neighborhood, getting into people's yards. When they get into school, they have trouble dealing with the behavioral expectations in the school setting. So they have trouble once they hit the school years, for sure. So those are the parenting styles. Temperament is essentially the foundation of personality. It is the traits. We can see, I'll just highlight this a little bit. It refers to the traits that influence how you behave and interact with the environment. So how you interact with other people, for instance. So we could talk about difficult temperaments. So think about that just for a minute. If a child has a very difficult temperament, are you as a parent or caregiver going to want to interact with that child if every interaction is difficult? So you get the idea. Interaction may be curtailed because it's just not very reinforcing on the part of a parent or caregiver to interact with that infant or that child. And so difficult temperament can be something that can evolve into more difficulties later on for the child. Easy temperament, we sometimes hear that term, the easy temperament, the adaptable, easy to soothe. Well, those are the reinforcing ones to interact with, right? So if you have a baby that smiles when you smile, hey, that's pretty cool. It's fun to interact with that infant, and so they elicit a warm, responsive parenting more so than a child with a difficult temperament. So it really depends. It's a two-way street. The development of personality is through interaction, and those first interactions are important, especially with parents and caregivers, because that really sets the stage for subsequent interaction patterns later on. Certainly, the importance of play. This is, we could spend certainly a whole class period just on that, but the idea is play is necessary for proper development, proper cognitive development, proper social development. Children need to learn to play with each other. They need to learn to share, for instance. They need to learn how to play in a pro-social manner, in a nice way with other kids. So there's the importance of that, just interacting with objects. Legos are just such a brilliant little thing because you can make stuff out of them, and they're really helpful for cognitive development. Absolutely. And then just you could look at exercise. Kids need to get exercise. And there can't be too much play that's on the video game machine. There has to be play that's outside. More is being made now of just going out and playing outside in the dirt and interacting with the microbes in the soil, in terms of developing a healthy immune system and having fewer allergies later on in life. Playing in the dirt, playing with animals in the home, for instance, having animals in the home is associated with fewer allergies. Um, and now I'll just mention, like speaking of allergies, peanut allergies. Uh, Fairly recent research is indicating that exposure to peanuts as children, if you can expose kids to peanuts, then they early on they tend to not be sensitive to them, like kids who are just never exposed to them. But you know, some people have severe peanut allergies. They go into anaphylaxis, and you know, you need to get the EpiPen out and just so you can start breathing again. So you know, play is important, but you know, play, exposure to a variety of foods, a variety of microbes, exposure to animals, all of this is important for development cognitively, development of the immune system, development socially, you know, just being able to get along with others. Adolescence. So we could talk about the physical changes in adolescence. Adrenarche, you don't hear so much, but the development of the adrenal gland, the gonad arc, the primary sexual characteristics and the secondary sexual characteristics, the menarche, or the beginning of menstruation, the spermarche, beginning of sperm production. You know, this essentially marks the person becoming capable of reproduction, and so there are, you know, the sequence of this is important. For instance, boys who mature earlier tend to be socially well adjusted and more well adjusted than boys who mature sexually later. Not the same for girls. Girls who mature sexually earlier tend to have some adjustment problems. So part of it is they begin being objectified sexually when they're emotionally not ready to handle it. So it's a big change and can be the source of a variety of problems. Now we could talk about the growth, the development of the frontal cortex. The frontal lobe of the brain is an area that continues to develop. We have synapses continuing to form in the frontal cortex of the brain beyond age 12. So you know, there's good evidence that you know, cognitive development is not done by age 12, but in fact continues into the mid-20s, if not even longer. So the synaptogenesis in the frontal cortex, for one thing, helps you to inhibit impulses. And think about impulse control. You know, who are among the most impulsive humans? Well, they tend to be teenage males. Well, that does tend to calm down, and usually by the mid-20s, after the frontal cortex is fully developed. So you know, the development of the frontal cortex is important. All right. I mentioned cognitive empathy, this idea of perspective taking that does really get better during adolescence. And that's tied right into the development of the frontal cortex as well. But this idea of being able to take the perspective of another, having a theory of mind, that is something that really develops and continues to develop through adolescence. Let's see here. Emerging adulthood, again, think about marriage and work. Think about, you know, kind of the way Erickson described it when we look at these, you know, ages of development. intimacy versus isolation. That's his stage for emerging adulthood. And then getting into the career stuff, generativity versus stagnation, that occurs later. But this is something that's really important. Okay, I'm saying a lot. I know I do. I just want to move on. A couple other things. Certainly, when we get older, it's important to be cognitively engaged with something. So playing games, but games that require reasoning, like chess or mahjong or Go or things like that, dominoes, helps to keep one's mind alert. I would also say playing a musical instrument, musical practice, or practice of a physical skill, playing sports. All of these things help keep a person mentally fit into old age, and that's really important. If you want to maintain cognitive function into old age, you have to be engaged cognitively. You have to read and exercise and interact and also deal with difficult situations, solve problems, not just like math problems or crossword puzzles, but real life problems. To actually be in difficult situations, solving problems. If you can do that, your cognitive function is probably going to be preserved and for longer. Socio-emotional selectivity is just the idea that we need this social support. Social support is very important, especially as we get older. Hospice, so when we get into death and dying issues, hospice is a better way to die if you want to think of it that way. Being able to have your pain properly managed if you have a painful terminal illness. If you can manage the pain and you can be at home where you're around the people and the things you love, then you're dying a better death than writhing in pain in a hospital bed, for instance, and not having that pain controlled and not being around the things and people you love. All right, so that's pretty much it for the chapter. It's a big chapter. There's a lot to consider. I've touched on some things, kind of glossed over others, but I think I've touched on most of it, certainly the stuff I consider to be the most important. What we'll do is I'll try to link up on the course links on the course homepage some developmental videos that will help illustrate some of the things that are in the chapter. So that is it for now. I hope you enjoyed this little overview. That's all.